All right, millions of Americans are using GLP-1 medications like Ozempic and Wegovy to lose weight, but new research raises questions about what happens when people stop taking them. So a new study found that people who discontinue these popular weight loss drugs start regaining weight within just 2 months.
Ooh, and the findings suggest that the rebound effect may be more severe than previously understood. So joining us now to discuss what this means for all the patients that are on this, ABC News correspondent Dr.Darien Sutton.
Good morning.
Good morning. Thank you for coming. So, Dr. Sutton, this study shows that people regain weight, we just said it, within 2 months of stopping these GLP-1 medications like Ozempic, Wegovy. So how concerned should patients be, like patients who don't want to be taking it in perpetuity?
Yeah, important to know and important to understand, especially if you're one of the millions of people using these medications. I think the most important factor to understand here is that weight gain after stopping these GLP-1 medications is not just common, it's expected. Obesity is a chronic, complex, lifelong condition, and I compare this very much for patients to understanding how blood pressure treatment works. Just the same way, when we're talking about treating a disease, when you stop that treatment, there is a very strong risk that it will recur.
So the research found that patients who lost the most weight actually gained it back, nearly 4 more pounds than people who never took the drugs. So what is happening in the body to cause this?
Ooh, yeah, very good question. What is happening inside of our body? So when you use these medications, they often target hunger in our brain, mainly with our appetite and us feeling full. They also slow gastric emptying. That's a word for the rate of time that it takes for food to empty out of the stomach. And they improve our sensitivity to insulin, which can reduce our risk of diabetes. Now, when you stop these medications, those physiologic drivers to obesity will return.
It's so interesting because I think a lot of people will hear something like this and they'll think, well, I'll just get started. I'll get healthier habits. And then once I've got the weight loss, maybe I can come off the medication and maybe it won't be a problem. But even patients who maintain that healthy lifestyle change seemingly gained weight after dropping it.
And I'm happy that you brought this up, and that's the mindset behind many. It's important to understand that there is no cure-all for obesity, and short-term treatments often do not work. There are in some cases where patients can take these medications and with aggressive lifestyle changes, they're able to maintain that weight loss, but the majority are not able to. And again, obesity is chronic, it is complex, and due to a variety of factors beyond our diet and our exercise, hormones, our environment, our brains, and that is why many people might have different outcomes by doing the same thing.
Okay, so for those patients that are getting on these drugs, you know, what exactly should we be telling them? What should doctors be telling them on the long-term use of it versus getting off of it after a year?
Yeah, you know, just like diet changes or lifestyle changes, if you're in this for the long-term benefits, you're unfortunately likely going to have to stay on it long-term. When you're having these conversations, important to discuss what risk factors you're trying to reduce, because not all medications are made the same. Some have been beneficial with reducing the risk of cardiovascular disease or heart disease. Others we found reduce the risk of kidney disease and so on and so forth. And also making sure that you're being mindful of monitoring while on these medications. And many people, unfortunately, use medications that they might get from third-party distributors that might not be verified, and that can expose you to those risks. So you want to make sure to get your blood tested, for example, your kidney function, your liver function, all those important numbers while you're on these medications.
Thank you so much for talking about like the real seriousness of the medical situation here. And I loved how you compared it even to high blood pressure. You know, just because you're taking a medication doesn't mean the condition went away.
Exactly.
And so when you stop taking the medication in some of these conditions, you'll still have the problem.
Absolutely. Thank you so much for some of
No, thank you.